Good day, colleagues. Today's the topic of our lecture is ischemic heart disease and its cardiovascular assessment. First of all, I want to tell about heart anatomy and little facts. The heart is about the size of a fist and weighs less than 1 pound. The average BPM is 72. The average adult heart pump about 7,050 liters of blood per day through 60,000 miles of blood vessels each minute at rest. Structure: covered by pericardium, parietal, visceral, outer heart layer epicardium, middle heart layer myocardium, and inner layer endocardium. The internal anatomy of the heart you can see on this picture. Here localized different anatomical structures is the superior vena cava, right pulmonary artery, pulmonary trunk, right atrium, right pulmonary veins, tricuspid valve, chorda tendina, right ventricular, inferior vena cava, and from this side is the aorta, left pulmonary artery, left atrium, left pulmonary veins, pulmonary valve, aortic valve, bicuspid or mitral valve, left ventricular, papillary muscle, interventricular septum, endocardium, myocardium, and visceral peritoneum. Pericardium. 4 hollow chambers is present, 2 upper atria and 2 lower ventricles, divided by septum and valves. On this picture you can see system of blood flow and the heart. Function of heart: right atrium receives deoxygenated blood, right ventricle pumps blood to lungs. Left atrium receives oxygenated blood, left ventricle pumps oxygenated blood to body. Atrioventricular valve closure as one heart sound, semilunar valve closure as 2 heart sound, coronary circulation. On this picture you can see coronary arteries, its localization, and it consists from right coronary artery, right atrium, aorta, left coronary artery, circumflex artery, anterior descending artery, and posterior descending artery. It usually can be additional. Here also anatomy, and you can see here aorta localization, vena cava localization, and pulmonary artery. Right coronary artery supplies blood to the right atrium, right ventricle, bottom portion of the left ventricle, and back of the septum. Divided in 2 branches, the circumflex artery and the left anterior descending artery. Circumflex artery supplies blood to the left atrium and the side and back of the left ventricle. Left anterior descending artery supplies blood to the front and bottom of the left ventricle and in front of septum. Coronary veins take oxygen, poor deoxygenated blood that has already been used by muscle of the heart and return into the right atrium. Peripheral vascular system consists from aorta, arteries, arterioles, and capillaries. Venules, veins, superior and inferior vena cava. 3 layers are present: intima, media, and adventitia. On this picture you can see structure of arteries, veins, and capillaries. Here you can see capillary network, lumens, tunica intima, tunica media, tunica adventitia in artery and veins, and difference in it. And here you can see valves. Peripheral vascular system functions is a circulation, peripheral vascular resistance, viscosity, length, diameter, blood pressure control. Mechanical properties of the heart. Conduction system. And here you can see how this conduction system form. It's localized a lot of nodes, sinoatrial node, internodal pathways, atrioventricular node, bundle of his, right bundle branch, left bundle branch, and Purkinje fibers. Mechanical properties of the heart. SA node, pacemaker, cardiac output, heart rate, stroke volume, the volume of blood pumped from one ventricle of the heart with each beat. Cardiac reserve, preload, Sterling law, afterload, contractile. Electrical properties of the heart. Action potential, polarization, depolarization, repolarization, refractory period. Filling and pumping, diastole ventricular filling and systole ventricular eject blood. The cardiac cycle, ventricular filling occurs during diastole. Blood is pumped out of the heart to the pulmonary and systemic circulation during ventricular systole. Assessment. Subjective. Health history, chest pain, SOB, leg pain, pillows to sleep, medications, lifestyle, from a diet, alcohol using, exercise, smoking, and drugs. From objective is general appearance, skin, wounds, pulses, uterine distension, edema, breathing. Diagnostic tests. First is a TEE, transesophageal echocardiogram, monitoring breathing, cough, jet reflex. Keep NPO until jet reflex returns. Doppler sonography is a medical imaging technique that uses ultrasound enhanced by the Doppler effect and it often provides helpful information about the flow and movement of blood and inner areas of the body. Monitoring of blood pressure. Wash extremities to remove gel after test completed. Also, we can use X-ray, CT scan, EBCT. Electron beam computed tomography is used to determine coronary calcium. Document client allergic to fish or shellfish. Pregnancy risks. Angiography, cardiac catheterization. MRI. Document presence of implanted electronic devices. Radionuclide scan increase fluids after the test. Monitors. Telemetry, Holter monitor. Teach about purpose is a portable device for continuously monitoring various electrical activity of the central nervous system for at least 24 hours, often for 2 weeks at a time. Dry skin, remove hair, avoid getting unit wet when to phone the MD. Contents overview: coronary artery disease, heart anatomy, atherosclerotic plaque or atheroma, angina pectoris, myocardial infarction, sudden death, overall management. Coronary artery disease. Unbelievable, smoking a cigarette while shoveling snow. Did he have a note? So, little kidding. CAD statistics. CAD is the largest killer of American male and female by statistics in the United States. 13 million Americans have CAD. 1.1 million myocardial infarctions per year. Every 26 seconds, an American will suffer from the coronary events. Every 60 seconds, an American will die because of coronary events. 42% of those having a coronary events will die from it. 350 people die per year because of a coronary event in emergency department before even being admitted to the hospital. Death rate in 2001 is 177 in 100,000, and this statistic is the same in our time. 84% of those who die from CAD are 65 or older. If under the age of 65, 80% mortality rate with the first myocardial infarction. Within 1 year of initial myocardial infarction, 25% of men and 38% of women will die. Within 8 years of initial myocardial infarction, 50% of men and women under 65 will die. An average of 11.5 years of life are lost due to a myocardial infarction. From important is 50% of men and 64% of women who have died suddenly where can did not have any previous symptoms. Sudden deaths. Those with a previous history of myocardial infarction have a 5-6 times sudden death rate compared to the general population. On this picture, you can see distribution of mortality due to coronary heart disease by age group. And here you can see how by age mortality level is 20-29 years, 30-39, 40-49, and else. Exactly, what's a coronary artery disease? And how or why does it occur? Start with anatomy. Definition. Ischemia refers to an insufficient amount of blood. The coronary arteries are the only source of blood for the heart muscle. If these coronary arteries are blocked, the blood supply will reduce. Key concepts: ischemic heart disease, caused by coronary atherosclerotic plaque formation, which leads to imbalance between oxygen supply and demand, results in myocardial ischemia. Chest pain, cardinal symptoms of myocardial ischemia caused by coronary artery disease. Here is ischemic cycle. Ischemia infarction give chest pain, give diastolic dysfunction and systolic dysfunction. All these give diastolic pressure, pulmonary congestion of PO2, wall tension, and cardiac output, catecholamines increasing, and MV oxygen increasing too. Causes: high blood cholesterol, high blood pressure, smoking, obesity, lack of physical activity. Risk factors: uncontrollable, sex, hereditary, race, age. From controllable is a high blood pressure, high blood cholesterol, smoking, physical activity, obesity, diabetes, stress, and anger. Why would there be insufficient blood supply to the heart? Remember that the coronary arteries are the only source of food to the heart. The coronary arteries may become partially, completely occluded. Atherosclerotic plaques. Atherosclerotic plaque definition and formation. Focal accumulation of smooth muscle cells, foam cells, cholesterol crystals, and lipid under the endothelium of the artery within the tunica intima. Given time, this plaque can protrude into the lumen of the vessel, reducing blood flow. Often develops at branch point of hairs within the vasculature. Blood is slowed and or turbulent. Here you can see structure of the vessel, which consists from intima, media, adventitia, and endothelium. So where does the plaque begin? Within the tunica intima, the innermost wall of the artery. What's the plaque made of? It's usually superficial fibrous cap made of smooth muscle cells, collagen, elastin, and proteins. Also contains macrophages, foam cells, T cells. Foam cells are one of the first cells found at the site of the fatty tract, which is the beginning of atherosclerotic plaque formation in vessels. Necrotic center of cholesterol, crystals, lipids, apolipoprotein B, and LDL. Here you can see how it happens formation of the plaque, and you can see that it begins from endothelium and intima, forming little plaque, and it's of course growing due to atherosclerotic process, and then block some part of the vessels. It can be different percentage of the blockage of the vessels, and depends of heat happens ischemic process, discharges of the blood flow, and complications like ischemic heart disease and infarction of the myocardium. And here also you can see internal visuality of the plaque due to intima. And so happens atherosclerotic process, atherosclerosis with blood clot, atherosclerosis, and spasm of vessels also present like a type of ischemic heart disease. And of course, main problem of it is ischemia of the left ventricular, main muscle of the heart, which doing pumping function. Here you can see blockage of the right coronary artery due to atherosclerotic process. So, atheroma. As the atheroma within the coronary arteries enlarges, the blood flow to the heart decreases, and therefore so does the oxygen supply. The heart is not in danger of hypoxia until 50% of the vessel is occluded. As the heart senses a decrease in oxygen, there is attempt compensation, increased heart rate, increased blood pressure, aggravation, worsening of the trauma. When 70% of the arteries is occluded, angina pectoris will occur. So, classification of the ischemic heart disease mainly is four types. It's myocardial infarction, is a sudden cardiac death, is angina pectoris, and chronic IHD with heart failure. Angina pectoris, at least 70% occlusions of coronary arteries resulting in pain. What kind of pain? Usually it's chest pain, radiating pain to the left shoulder, jaw, left or right arm, usually brought on by physical exertion of the heart is trying to pump blood to the muscles. It requires more blood than is not available due to the blockage of the coronary artery. Is self-limiting, usually stops when exertion is ceased. Angina pectoris can be stable or unstable. Stable. The pain are patterned to events in unchanged over a period of time, months or years. Unstable. The pain and pattern is changing, be it in duration, intensity, or frequency. Myocardial infarction waiting to happen. What is the myocardial infarction? The partial or total occlusion of the one or more of the coronary arteries due to an atheroma, thrombosis, or embolization resulting in cell death, infarction of the heart muscle. When a myocardial infarction occurs, there is usually involvement of three or four occluded coronary vessels. Myocardial infarction and its statistics, it's about 2050 deaths per year, 30% mortality within the first 2 hours, 45 minutes of ischemia, cardiac muscle death occurs. How is the diagnosis made? First of all is ECG and changes on it. Usually is ST elevation. It's myocardial enzymes elevation, creatine kinase, troponin, and C-reactive protein. When there is an atheroma is mentioned before there can be rupture resulting in thrombus formation because of the build-up of platelets. When there is breakage of the thrombus, there is emboli formation. An emboli can travel to the brain, cerebral infarct, can remain in the heart myocardial infarction, or even travel to the extremities cutting of blood supply. As the area beneath is disrupted atheroma hemorrhages, there can is increased risk of abscess formation and infection. Complications of myocardial infarction. Infarction leading to inability of the heart to function properly, leading to heart failure. Next is the angina and pain, cardiogenic shock, ventricular aneurysm and rupture, embolism formation, arrhythmias, Myocardial infarctions can lead to ventricular fibrillation. Shockable. Sudden deaths. 2,050 deaths in the United States per year are caused by what is referred to as sudden cardiac death. Sudden cardiac death is also known as a massive heart attack, in which the heart converts from sinus rhythm to ventricular fibrillation. In V5, the heart is unable to contract fully, resulting in lack of blood being pumped to the vital organs. V5 requires shock from defibrillator, shockable rhythm. Treatment. Many people are able to manage coronary artery disease with lifestyle changes and medications. Other people with severe coronary artery disease may need angioplasty or surgery. Management of ischemic heart disease. Pharmaceutical is beta blockers, act either selectively or non-selectively on beta receptor. Is calcium channel blockers, acts to vasculature blocking of calcium and causing vasodilation. Nitrates and hypercholesteremia. HMG reductase inhibitors. Reduction is man-made cholesterol, thus helping to reduce atheroma formation. Antiplatelet medication, clopidogrel and aspirin. Surgical treatment includes several points and different types. First, it can be stenting, angioplasty, and bypass surgery. So here you can see how we can apply stenting. It's a minimum invasive treatment which we can do through low extremity vessels, in which we enter special catheter and X-ray guideless. We enter this catheter to the heart, to the coronary arteries, and do stenting. Stent will open in the area of localization of the plaquette and thrombus, open it, and hold the foam. So we prevent any stenosis and blockage of the coronary arteries. Also present balloon dilation of these blocked areas of the vessels and rotational burn. Management of ischemic heart disease. Yes, by the way, before it's the first is the stenting. Also, we can use angioplasty when we can remove this part of the blocked coronary artery and apply there artificial material like a alloplasty, like a Gore-Tex, or autoplasty with using of oven tissues of patient. Usually we use for it vena saphena magna, big superficial vein. Also present bypass surgery. Bypass surgery when we're doing shunting. We're doing shunting round side, one part, distal part of the artery from proximal part. So we can have normal blood flow. And bypass surgery also we can use and doing by alloplasty with any artificial material or oven tissues whence patients whence. Management of ischemic heart disease is a lifestyle, of course, is very important. It's diet, exercise, preventive treatment, low fat, low cholesterol diet, cessation of smoking, and red wine. A lot of physicians from the France, Italy, and some more European countries have clinical tests and investigations in which they know and have results, very good, successfully results of the in patients which using wine, but it should be dry wine. It's the best for any prevention of the heart diseases. What about nursing assessment? It gathers information about all facets of the client's activities, especially those that proceed and precipitate attacks of angina pain. Assess the risk factors in the client's history and modification possible to reduce risk. If chest discomfort is present at the time of the interview, further collections of data is delayed until pain and dysrhythmias are resolved. A complete physical assessment is performed to identify the presence of chest, epigastric, jaw, back, or arm discomfort, which is then rated on a subjective scale of 1 to 10 in intensity. The client is questioned regarding nausea, vomiting, any dysphoresis, dizziness, weakness, palpitations, and SOB. Nursing diagnosis is a pain related to myocardial ischemia, altered tissue perfusion related to imbalance between myocardial oxygen supply and demand, anxiety related to fear of death, and knowledge deficit. Plan and interventions. Goals: prevention of pain, improve tissue perfusion as evidenced by absence of chest pain and absence of dysrhythmias, reduction of anxiety and increased knowledge of disease process. Interventions must teach the client a link between the symptoms and activity. They need avoid activities known to cause angina, such as sudden exertion, exposure to cold, and emotional assessment. Medications used in the treatment of angina include nitrates, beta blockers, calcium channel blockers, and platelet antiaggregants. Administer cardiac medications as prescribed and be alert for adverse side effects, particularly the effects on blood pressure. Teach the client the symptoms to be aware of and what measures to take. Encourage the clients to remain or bed rest in order to decrease cardiac workload and oxygen consumption. Administer oxygen therapy and prescribed as prescribed. Evaluate vital signs hourly to determine the hemodynamic effect of the drug and the client's tissue perfusion. Nursing care should be planned so that minimal time is spent away from the bedside due to the high level of client anxiety as well as the unstable condition of the patient. Clients with unstable angina are at high risk for myocardial infarction and sudden death. The nurse watches for development of heart failure and dysrhythmias. Relieving pain is the top priority for the client with an acute myocardial infarction, and medication therapy is administered to accomplish these goals. Maintain patent administrations, intravenously administrations of fluids and vasodilators and anticoagulants therapy, nitroglycerin and heparin. They relieve pain and they aid in minimizing permanent injury to the myocardium. Prepare for possible emergency heart catheterization or CABG. From interventions, whether CABG is planned as an elective procedure or performed on an emergency basis, the nurses should try to evaluate The clients and the families exit and assist them in understanding the need for this life-saving procedure. The nurse describes the postoperative course, emphasizing the close monitoring and use of sophisticated equipment. The client is encouraged to tell the nurse about any discomfort post-operative. Encourage the client and family members to verbalize their fears and concerns. Teach the client the nature of the illness and the facts needed to reorganize living habits in order to reduce the frequency and severity of angina attacks, delay the progress of the disease, and avoid other complications. Evaluation verbalizes relief of chest pain, no sign of respiratory difficulties, modify lifestyle in order to prevent future attacks, demonstrate increased knowledge of disease process and reduction in anxiety, absence of complication. Thank you very much for attention, and on it we can finish our lecture. Wish you success. Goodbye.